medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
There is so much difficulty with our patients falling asleep at night. I thought we'd do this particular video just to look at some of the major ones and how we could maybe deal with them. And many of these factors include stress and anxiety, which so many people have at this point in time. The room is lit way too much. And remember, you have to have something that's less than a 3 lux camera, which is no more than moonlit, to be able to develop melatonin in the system. Hey, this is Dr. Mitch, and thank you so much for watching this video. You also should consider perhaps their home is too warm. The optimal amount that I've ever read in the data is around 68 degrees. That's the perfect amount. Cold for a lot of people, but a much better sleep. Of course, pain and other medical conditions can lend itself for people not sleeping. Really, functional disorders tend to let people sleep, but when there's an actual significant disorder or pain, it will wake someone directly out of that sleep. Taking too much caffeine, especially for someone that has caffeine sensitivity. Look at irregular sleep schedules, people that go to sleep one night one time, another. Remember, getting to bed no later than midnight to 1 a.m. is the suggested time for the release of melatonin. And of course, the electronic devices before bedtime, because the blue light interferes with melatonin production. Also, look at the Wi-Fi. I tell folks, turn the Wi-Fi off in the house. Think about it. It's producing a wave all the time. It's bombarding our bodies all night long. And we have seen in several studies an increase in certainly autoimmune disorders because of it. So have your patients turn it off. Poor mattresses. If you don't have the proper, mattress, or the proper length of mattress, or the proper insulation of mattress, or even if you have a new mattress that's outgassing, and some of them outgas for a long time, some toxins, that can stop sleep or getting to sleep. Noise pollution. If they're in an environment where neighbors are noisy or the neighborhood itself is noisy, and perhaps something to mask that would be important. Digestive issues we often forget about. So if someone is eating within 3 to 4 hours of bedtime, I often tell the patients, don't eat 3 to 4 hours of bedtime if it's possible, because then the body is working on digestion. And of course, things like alcohol consumption should have nothing even to be thought about. Obviously, in some cases, it's a depressant and allows people to sleep better, and they say they do. In others, it can be quite the opposite and have what we call a paradoxical effect. Jet lag. Lots of the patients are moving about a lot, and because they're moving from locale to locale, their circadian rhythm, which we'll talk about in a moment, gets disturbed. And of course, never forget medications. There are so many of them that have insomnia. If you're not sure, you can always look on Facts and Comparison or one of the other databases to determine. Also, folks, as they get older, tend to do napping. And if they nap more than 20 minutes and don't enter REM sleep, they tend to have a difficulty getting sleep and getting to sleep at night. In addition, if they nap too late in the afternoon, they'll have the same problem too. And a lack of or too much of physical exercise can also contribute to their difficulty getting asleep. Certainly, exercise is excellent. Exercise is excellent for relaxation. Doing it too late towards bed could be actually stimulating. Now, there are circadian rhythm disorders, and they need to be addressed accordingly by resetting them, by resetting the melatonin SAM combination. SAMe, S-adenosylmethionine, is elevated in the morning, of course, while melatonin is low, and that reverses during midnight. Perhaps it's the highest reversal. Allergies, people that can't breathe through their nose, or deviated septum, or sneezing through the night, or something like allergies from dust, where you have a fan on blowing it in someone's face, may disturb them enough to get a good night's sleep. Pretty much everyone's aware of the hormone disturbances, specifically in women after they go through the age 30 or they head towards perimenopause and menopause. A lack of progesterone, which is the precursor to gamma-aminobutyric acid. And there are disturbances of mineral deficiencies as well, like magnesium, sodium, potassium. Any one of them can cause cramps. And also consider melatonin deficiencies and B6 deficiencies and tryptophan deficiencies, the precursors to melatonin development. If someone's taking, for example, a beta blocker, it inhibits the initiating step towards melatonin. And of course, you could test it. Saliva testing we do all the time will tell you where their melatonin levels are at bedtime and in the morning as well. So restless leg syndrome will also create a problem, obviously, for those people. The underlying cause, whether it's iron or one of the different electrolytes, it should be addressed accordingly. And of course, depression and the anxiety, which we talked about before, will make a difference. The key, of course, is to find the underlying cause. By looking back at what we just talked about in these particular items, your treatment protocol will be much easier, and pretty much any disease can cause difficulty getting to sleep, which you should be aware. And if you need more info, just write to me at drmitchghen.com. That's drmitchghen.com. Thank you so much for watching.